पाफ्स पे आ गया था, स्टिल जो मॉर्निंग की एंजाइटी या मॉर्निंग में उठ के डिस्कम्फर्ट होता था वो होता ही था। और काम का प्रेशर इतना ज़्यादा है कि मैं रुक नहीं सकता। और दूसरी चीज़, बीच में उनका जो वो उन्होंने एलर्जिक बोला था, दैट वाज नॉट एलर्जिक बट इट वाज अ फंगल इरप्शन विच हैड एग्रावेटेड इन जून मंथ ऑल्सो। और जब हमने मेडिसिन दिए थे उसके बाद उनको बैक पेन स्टार्ट हो गया था विच वाज अ रॉन्ग डायरेक्शन, और डिस्निया रहता ही था विथ आर मेडिसिन, एंड देयरफॉर आई फेल दैट वी आर गोइंग समवेयर रॉन्ग। और फीलिंग उनको ऐसे लगता था कि सांस अंदर अच्छे से नहीं पहुंच पा रही है। एंड एवरी टाइम ही वुड कम अलोंग विद द वाइफ सेइंग कि मैं कभी भी, मुझे ठीक नहीं लग रहा है। एंड यू नो दैट आई प्रिस्क्राइब्ड हिम एवरी, मतलब आई kept on changing the medicines, I have prescribed him so many medicines and all failed. And then finally I could understand what this personality was actually talking about. He had immense pressure of time, he had lot of work pressure, and since he was very good in making and melding the machines, इसके पास काम बहुत ज़्यादा आता है और काम का प्रेशर हमेशा रहता है, ही इज़ वेरी पर्टिकुलर अबाउट द टाइम। और वो हमेशा अपने काम से ही हमारे पास आते थे। और इतना काम उनके लेबर्स नहीं कर सकते हैं जितना वो करता है। और ज़्यादा प्रॉब्लम था कि मुझे एंजाइटी बहुत होती है कि ईएमआई निकलना है, चारों तरफ से काम का प्रेशर रहता है, और उसके बाद से लंबर पेन और बढ़ते जा रहा है। तो दिस वाज द रॉन्ग डायरेक्शन विच आई कुड फील दैट आफ्टर गिविंग अ मेडिसिन I felt that the lumbar pain started increasing, and therefore this was a case which was not treated correctly by me initially. But then when understood that what was my problem, since we have radar in the hand, he complained of lumbar pain initially. He said कि ज़्यादा काम होता है तो कभी कभी ऐसे lumbar pains आ जाते हैं, but then after analyzing the case completely I could understand ki the tools what sir has given can never misguide you, and definitely I'm going into a wrong direction. And after giving the correct medicine, the patient started feeling better within hours, and he said कि मैम ऐसी मेडिसिन आपने ये 8 महीने में भी नहीं दी थी जो इस बार दी आपने। एंड आफ्टर गिविंग द राइट मेडिसिन, the patient does not take any inhalers, and even he does not feel the need of coming for the follow-ups. He was very sincere, coming every week, and since November I have changed the medicine. The reduced frequency of follow-ups have come up, so I can see the drastic change since there is last week last month say there is drastic change of weather. It is expected that asthmatics need to get aggravated, but this patient did not go into aggravation after giving the right medicine. So this is the beauty of Hering's law. If you understand what direction the cure is taking place and what direction your patient is going into. So, any interpretations? Come on, the whole case is in front of you. I will later on tell you what mistakes I have made and what set of mistakes I have made. Once I gave importance only to anger, then to everything. So, let's go to the totality and understanding from your side. Anyone wants to come up? केस क्लियर नहीं हुआ, थोड़ा सा लैंग्वेज का इश्यू हुआ है। केस थोड़ा सा जम्बल्ड अप प्रेजेंटेशन में है क्योंकि केस जैसा था मैंने वैसे ही प्रेजेंट किया है। आई डिड नॉट मोल्ड अ सिंगल वर्ड, सो दिस वाज द फ्लो ऑफ द पेशेंट, सो वी हैव आल्सो गॉन विद द सेम पेस। आई हैव नॉट मैनिपुलेटेड एनीथिंग, no change in the history, word to word the way patient has given, the way the doctor has taken the case is being presented.
Ma'am,
Yeah.
he's a type of will is weak willed. He wants the support, but he doesn't take it completely like calcaria. It's not like a calcaria like support चाहिए. लेकिन I mean to say relationship चाहिए, but not as a clinging type of support. One, and secondly, his ambition was deceived. Like he wanted to study, but he couldn't, and the responsibility was put on him, on the business
How will you correlate, Dr. Kusum, with the emotional pathology we have understood? Can you see the reflection what we have understood in this case?
Yeah मैम, he wanted his brother, like like वो brother लोग उसके साथ वो लोग ने तोड़ दिया ना, like they were he had said that सब उनको लोग एक तरफ हो गए और वो अकेला रह गया. So
Hmm.
there was that feeling कि मैं अकेला रह गया. That feeling was there कि मुझे उन लोगों ने अलग कर दिया, and
Yes.
he was hurt there.
Yes. And what about other things? Anger.
Anger is suppressed, and even he is sensitive emotion, and he is not crying in front of others. He will go alone and cry. See, anger है, suppressed है, he is not showing it.
So there is a taint of esteem also,
Yes, yes, yes.
but not to the level of कि ऐसे कैसे बोला, to the level of insult वाला बात नहीं है.
नहीं है,
ठीक है,
नहीं है,
इसीलिए
insult वाला
बोन्स
बात.
नहीं है.
Yes, 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 ma'am. True.
है ना. तो व्हाट
Yes,
इज देयर इज मोर ऑफ एंटिसिपेशन. मम्मी चली गई तो क्या होगा, कौन मेरा सपोर्ट बनेगा,
true, true.
पापा के जाने के बाद क्या होगा, ईएमआई अभी नहीं भरा तो क्या होगा, 20 साल बाद क्या होगा, दुकान को सरेंडर करना पड़ेगा तो आई हैव टू बी प्रिपेयर्ड, आई हैव टू गिव माई शॉप टू समवन, तो आई हैव टू बाय अ परचेज अ शॉप, लोन लेना पड़ेगा. सो लॉट ऑफ एंजाइटी विच इज देयर सिंस चाइल्डहुड.
Yes, ma'am. Lot of anxiety, lot of anticipation, and being a tent, there is a tent of esteem. So he is like, कैसे करूँ? There is somewhere की fear है, that is it. That's what it is telling ना, fear of insecurity feeling. कि
Yes.
कैसे करूँ, कैसे भरूँ, कैसे ये करूँ.
And therefore if I don't do it I will be insulted. That fear of being insulted is there कि चार के
Yes,
सामने मैं कैसे फेस करूंगा, है ना. I
yes,
have that
yes,
courage, I can fight back, but I don't have that courage to fight back on that person with that same individual on that time,
yes,
है
ma'am.
ना.
Yes, yes,
And
yes.
yes, and the most important thing is in this case, if anyone else wants to highlight something, so give your totality, Dr. Kusum, your remedy.
So, madam, he is being a esteemed remedy. He wants that that fear of being insulted. So I feel, and so for that he is doing lot of industriousness. Hai. He is doing lot of hard work, and thinking of future, कैसे होगा, and I feel he is, and though he doesn't have this, oh, being alone, if I take that, I will end up with Natrum or Bryonia.
Okay. ठीक है, put up your totality with the remedy. Let other people also get a chance. A wonderful explanation. Thank you, Dr. Kusum. I think you have gone to the depth of the case. Dr. Anjali, you have written is. Can you explain, Dr. Anjali, why did you take all these things? Non-diligent, very sensitive, affectionate, emotional, helpless feeling, anger suppressed, anticipation, anxiety, fear of being insulted, and do hard work. Anyone else, please come up with your totalities very fast. Anyone wants to have a discussion? Is it so difficult? This time last week, everyone was so active. So many totalities came up with so clear discussion with clear remedies coming up. Everyone wants cooked food. No one wants to take an attempt. This is not what Sir has taught us. I've given you the process. The whole process is there with you now. Only you have to set up all the pearls which are here and there and just make it a strand. The whole totality is there in front of you. Come on, guys. Fiona, ma'am. Let me.
Hello.
Yes, ma'am.
I've decided a remedy, but just the emotional part of it is that a lot of anger suppressed, anticipation, non-diligent,
Yeah.
has of course a weak will because he's gone into all the habits of the before this, and this is the main core of it. And if you go to see, there are many remedies coming up, like even lycopodium is there, but I am not because he's chilly.
Yeah.
Lycopodium should be ruled out. I've not really got into which remedy as such, but just the core of it was this part of it, the emotional part of it.
Okay. Fine. A good try. Anyone else want to go ahead? Anyone wants to go ahead with the totality? Is it so difficult? Dr. Anamika, you would like to participate? I'll give you 5 minutes. You all can put up your totalities over here. This is from Homeopathy Clinic, Homeophores. Doctors, I would request you all rather than putting up your clinic names, you please personally log in with your personal names and identity so that we can know whom we are talking with. Thank you for your participation. Uh, Sensitive, aggravation, consolation, insecurity, anticipation, plans for the future. He's cautious, he's careful. His need is security in love. Yes, definitely. Delusion wrong he has done. Why would you put up delusion wrong he has done just because he has spoiled his health? Is it to the syphilitic level? Is it to the structural level that we will consider delusion? So, why would you take delusion over here? Because delusion is going to be there when it is at the structural level, or some diseases are at the irreversible pathology has developed. Here, you cannot go with the delusion part. Still, it is not structural, but still a functional disease. Asthma comes up under a functional disease because the spasms which are there are temporary, and there is no over a period of time. Yes, asthma can be structural when it is a very prolonged asthma not responding to any treatment and the patient is dependent upon steroids and bronchodilators, and over a period of time, after years and years, the spasms they become adaptive, and then the dilatation of the bronchioles take place, leading to bronchiolitis or bronchiectasis, where they lose the elasticity and they become hard and land up into COPD. So till then, it is going to be at the functional level, so we cannot take delusion as per in this case. I will not prefer delusion as to be taken up. And since the patient is not even coming to you in acute respiratory distress, so also I will not take any delusion in this case. Still, if you all want your totality, please put up your totalities. I don't want to feed you like anything, huh? Forsaken feeling, yes, definitely forsaken feeling is there in and out in this case, because he feels he is being left alone. There is anticipatory anxiety which is there in this case. Now, before giving, till the time you all are posting the right rubrics or your rubrics, anyone wants to give any medicines which are coming up in your mind? Naxwamika. Why, Dr. Nena? Why you want to go for Naxwamika? Don't jump up with the remedy. Come up with your totality first. See, this lecture series is not only a lecture series but also a workshop where you can practically imply whatever you have assessed, put up on the paper, repertorize it, and then let me know. Just don't jump. Dr. Nena, I want your totality. See what happened when I was taking this case, when this case was being presented to me, I gave more importance to his anger, aggressiveness, the violent behavior he has, and बोला उन्होंने कि मुझे कभी किसी बात का डर नहीं रहा. एंड दिस इज द ब्यूटी ऑफ साइकोसिस व्हेन यू टेक इट इन द सुपरफिशियल लेवल. एंड ही सेड दैट आई डेवलप a hatred if someone offends me. So the first remedy I described prescribed to him was Morsol 200 one dose. And the beauty of predictive homeopathy and Herring's law is that after prescribing Moxol, the 15 days follow-up says that he had dyspnea and now he regularly needs the inhaler. The wheezing is somewhere better, but now he's complaining of breathlessness on climbing up stairs and walking, which was not prominent before. और अगर इन्हेलर नहीं लिया तो मुझे बहुत घबराहट होने लगती है, बेचैनी होने लगती है. नाउ आई हैव अगेन स्टार्टेड विद द रैशेस व्हिच वाज देयर present before, and my bowels are not clear, no bleeding is there, but still sleep is normal. This was my whole assessment. And since he has complained of breathlessness with dyspnea, I felt this is a wrong direction and I made a mistake, because breathlessness should not increase, and especially on least exertion and walking, which is supposed to be not there. And I changed the remedy and I gave him natromu 200 one dose. And after that, the dose, I said that, he said ki now the wheezing has reduced, the back pain has reduced, now no pain, only if I exert a lot the rashes are same, itching is same, dyspnea is same. Till now I need daily inhaler, and if I don't use inhaler I feel anxiety and ghabrat. But at this time patient had not come. Again I went overconfident and I felt that wow, this is my result and I have been waiting for this. Being overconfident, I again repeated natromu 200. To my dismay, because somewhere he must have said ki I'm slightly better, therefore I became overconfident and I again repeated natramute. Again, when the follow-ups came up, I asked him ki delay the inhalers what he's taking by 3 4 hours, and he said ki after your second medicine, I'm able to delay the time period of my inhalers. The duration which was supposed to be 2 hours has come up to 4 hours, but still I need that inhalers need. My lumbar pain is better, uh, and again I have come up with something coming out per rectum, but still no bleeding. And I'm not doing any of the fasting because that was a Ramzan period, and he said I'm not able to do any fasting. And still ghabrat is there, and I felt again, I don't know why, but I again felt ki the remedy is right, so I stuck to that remedy. And after some days he said ki now I feel better, I have not used inhaler since 2 days, and lumbar pain has increased, I'm not able to do any exercise, I'm completely on rest. Now I have complaint of eye redness because some welding particle has gone into the eyes. And I still waited for this case, I had prescribed SL. Then again in May he came up कि again the need of inhaler has come, but that is in the morning hours. And the other complaints, the itching has gone, everything has gone, but now it is a humid damp weather, so I feel breathless. And I see that now again, so I felt that somewhere there is a mistake, somewhere I need to repeat, so I repeated natramur again back in this case. And after that he said in month of sixth month that I am absolutely better. Now I've complained of some throat irritation, cough is there, and all the other complaints are settled, but now hair fall is there. And and that time his wife had delivered, and she had some fever after that. So he said I became anxious क्योंकि wife की report को देखकर मैं थोड़ा सा anxiety में, she suffered jaundice, और क्या होगा, खर्चा होगा कहाँ से, बच्चों को संभालूंगा और फिर कैसे खर्चा संभालूंगा। और फिर जब वाइफ की रिपोर्ट कोविड को निगेटिव आई, देन ही वाज relaxed, so he said there was certainly anxiety, so I still waited in this case. And but again in the sixth month he said he suddenly I have started feeling dyspneic, there is wheezing which has come up, throat irritation with cough, but there is no weakness. And I'm doing a heavy workout, a heavy exercise, and I have severe leg pains and severe lumbar pain which is there, and the dyspnea is on slight exertion, there is dry cough, ठीक है। And this was again I prescribed an acute remedy over here thinking that it is an acute attack, which was again a mistake done by me. Then he said ki after giving this, again the need of inhaler has increased, I now need two inhalers, bottles which is puffs at a time, and in one capsule I take 3 rounds, I feel I'm little bit better, and I can perform a heavy work. So I interpreted that he is going better and better, and even I have mentioned that this is a good follow up because I could feel that chest congestion is better, everything is going better. The lumbar pain I neglected, and the lumbar region rashes were there because of fungal infection, and it was a humid weather. So he said, "Ki every humid weather I get this, and the itching is so severe, doctor, that I get an instinct that I should apply something, but you have asked me not to apply anything now. So I am getting anxious about this fungal eruption, so you need to do something." And I have lot of work, and again I reviewed a case because this fungal infection should have not increased to this tremendous intensity which had spread to the abdomen up to and to the thighs and the backside completely. So I reviewed the case, and I again concentrated upon was the simple thing was that he is very workaholic, he has got that mechanical aptitude, he is creative, he is artistic, he wants to channelize his anger towards the work part. So I gave him sulfur irrespective of his thermal and thirst. I felt ki this is somewhere I need to review the medicine. and because itching was so severe in the night that he could not sleep, but lumbar pain was there, so I gave him sulfur 201 dose. Again, after that, I saw and I found that every complaint had increased, and along with this, there is now dyspnea with perspiration and cough with lot of expectoration, and now there is lot of work. And he started begging me saying that, doctor, now I have lot of work with me, I have no time even to come for your follow-ups, and if certain things continue like this, I have to keep a break, and because I need so much of inhaler, should I take some bronchodilator, some syrup, or some tablets more, because the work pressure is a lot of pressure is there now, and now I cannot bear this complaint. और जो आपने पहले मेडिसिन दी थी उससे थोड़ा बेटर हुआ हूँ, पर मेरे जो एक्सपेक्टेशंस थे आपसे, वो एक्सपेक्टेशंस पूरे नहीं हो रहे हैं, क्योंकि मुझे नीड तो है ही ना ब्रोंकोडायलेटर की या पफ्स लेने की। मैं कब इस पफ से दूर हो पाऊंगा, या मैं कब पफ से ठीक हो पाऊंगा। एंड ही सेड कि बहुत ज़्यादा काम है मेरे ऊपर और इतना प्रेशर, और हर हफ्ते मेरे को अगर आपके पास आना पड़ा तो आई एम लूजिंग माई टाइम। एट दैट टाइम आई क्लिंग्ड कि कुछ तो भी है जो मैंने गड़बड़ किया है इस केस में, एंड आई रेड द केस अगेन, आई रिव्यूड द केस। at that time I felt कि somewhere time is really very important for him. Again, I repertorized the case and gave the right remedy. And when you read the remedy from the book, you will understand the beauty of homeopathy. And after that, after giving, uh, uh, again, I even went up to prescribing sulfur 10 m, but still no relief. The symptoms kept on aggravating, and at the time he said कि after giving sulfur, the aggravation was so bad that he could not sleep. He has to wake up in the 3:30 in the morning, and he gets so restless because of perspiration, hot feeling. He wants to have open air, and that ghabrahat is not better by anything. And there is a cloudy weather, humid hot weather, and I cannot breathe. I even gave him Kali Sulf 200, which for my dismay was again a wrong prescription, and again an accident for that patient. I'm accepting all my faults because I know that I was somewhere hurried, hasty. I gave importance only to that concomitant symptom that he has become restless, he has become humid weather aggravation, but some quarrels with the family, and I felt ki this is what has to be done. Then he came up in October with an acute remedy, with an acute episode of coryza, and the dyspnea was not there, no breathlessness was there. The patient was somewhere happy, but the eyes congestion